Hey everybody, it's Joel with Achieva Rehabilitation coming back to you with another educational tip. This time we're going to talk about dizziness and vertigo and lightheadedness, spinning, those kinds of things. What is the difference? What are you actually talking about when we use those terms? It's different in everybody. So anybody out there that's suffering from any type of dizziness, lightheadedness, fogginess, vertigo, I want to clear that up to make sure that we are communicating properly when we're talking to healthcare practitioners to help those symptoms. We do this a lot with patients. We work a lot with people who have dizziness, vertigo, etc. And a lot of times they use terminology and they're not certain what it actually means. So the big one, vertigo. Vertigo does not mean what everybody thinks it means. Okay, vertigo is a very, very specific term that means the false sense of movement. So you feel a sense that either you personally are moving or your surroundings are moving. That's exactly what that is. It gets complicated as to why that happens, but it is the false sense of movement, okay? So just like when you're a child and you grab onto the stop sign and you run around it 10 times and you stop and the world keeps spinning for a few seconds, that is vertigo. There's a reason for it. If you want to look in deeper to it, let us know. Contact us here. Contact us on our website. Vertigo is very specific. False sense of movement, either you or your environment. The other terminologies that people will use, dizziness, lightheadedness, fogginess, those kinds of things are different, and they're just generally hard to describe. It's just a sense that your brain is not kind of connected and your eyes are not kind of connected and you just don't feel like you're in tune with your movements and your vision and what you're seeing and how things appear to you. And those things can last short periods of time, long periods of time. But there is a drastic difference, and that's the main point of this video, is that vertigo is very, very specific in what the definition of vertigo is, whereas the other types of ways to describe what you may be feeling, dizziness, lightheadedness, fogginess, those kind of things, could be coming from the same area, the inner ear, or they may come from other issues, which we would love to help you find out if you have it. But reporting those symptoms to us specifically is very, very important. Now, the last thing I'll leave you with is a lot of people that actually have that false sense of movement, vertigo, we love when they have it. It's probably my favorite thing to have to deal with because in most cases, that vertigo, that false sense of spinning, most times when you're laying in bed, rolling in bed, getting up from bed, bending down, looking up quickly, if it lasts a short period of time, it's actually very easily fixed, usually within 5 to 10 minutes by a skilled physical therapist. So I hope that makes you comfortable if you have any of those symptoms. Hope it clears up some of the misconceptions about the wording. And we would love to help anybody, family, friends, you personally, if you ever have those symptoms going forward.